Welcome to Roots and Resilience. I'm Dr. Tejal.
And I'm Dr. Nehal. We have had some incredible conversations with inspiring individuals that we feel compelled to share with you all.
Listen with an open mind and an open heart. You never know, you might just pick up a pearl that might spark something in you.
Enjoy.
Welcome back for another episode of Roots and Resilience. We are absolutely thrilled to have with us Dr. Aditi Bhalla. She is a specialist dentist, specialist in prosthodontics, an integrative psychotherapist, founder of Compassion Focused Dentistry and the Dental Wellbeing Hub. With over 15 years of experience in dentistry and a deep insight into mental health, she's helping professionals prevent burnout, build sustainable well-being tools like mindfulness and self-compassion and movement. And we're really excited to hear about her journey. And I think she's going to have lots of really interesting things to share with us today. So without further ado, welcome to Roots and Resilience, Aditi.
Oh, thank you so much, Tejal and Nehal. I'm really, really, really looking forward to our conversation ahead.
Wonderful.
Fantastic.
So
I'm just going to jump right in there. What a great introduction. And I know that you've achieved so much and you do so many amazing things, and you're dedicating all your time now, from what I understand, to helping professionals thrive and, regain joy.
Yeah.
In their professional lives, which is amazing. And I think it's something we don't pay enough attention to.
Mm.
What is an integrative psychotherapist?
Right. Okay. So basically, it means combining different techniques, different aspects. And for me, that means is combining the science and the spirituality. Because I feel that it's not just about the mind or the body. They're not separate. And the mind, body, spirit, they all go together. When you combine them all together, the healing that comes through, the growth that comes through with it, it's amazing. I've experienced it myself, and that's what I bring forward.
So we're going to rewind.
Yeah.
That's amazing. I'm definitely going to explore that in more depth. But we're going to rewind right back to the beginning. Tell us about your journey, your childhood, when you were born, who's in your family, what your parents did. Give us a little snapshot into that.
Yeah. So I was born in India, and
Whereabouts in India?
in Bangalore, but I've never lived in Bangalore.
Wow.
So yeah, I was just there until the age of 1, and then I moved. I have moved a lot in my life, and then I lived in a small town near Delhi. Then I moved to Dubai, did part of my schooling there.
How old were you when you moved to Dubai?
Was 14.
Okay, so you spent quite a bit of your childhood in India.
Yes,
Right.
yes.
And what prompted the shift to Dubai?
My dad, yeah, he did. So yeah, we all moved along. And yeah, I've got a younger brother, and no one in my family is from in any sort of healthcare profession. So
Right.
then
What did your parents do?
my dad's into marketing and my mom's a teacher.
Okay.
I think that's where the teaching genes have been passed
I
on.
was going to say there is definitely something in your family that's been carried down.
Yeah. So that's the teaching gene. And yeah, my brother now is living in Dubai. He works in finance, and yeah, so nobody even far away is into any sort of healthcare stuff.
So what was the transition like as a 14-year-old? You've just kind of probably settled in school, you've got your friends, you're just, probably doing well, you're a bright kid, like, and then being uprooted at that sort of kind of tender age, but you're kind of still figuring things out. Like, what was that experience like?
It was really hard. But for me, because I moved like quite a lot, like it was quite a thing. It's like something that I accepted very easily. But it
So
was
did you move like areas in terms of living or just moving schools or both?
as yeah, both.
Right.
Yeah.
Was that because of your dad's work?
Yeah, because of my dad.
Right.
Yeah. So yeah, and I think moving from a co-ed school to moving to an all-girls school was shocking to my system. It was just a completely different environment, completely different ball game. Also, living in India is completely different versus living in Dubai. There's a huge cultural difference as well. Yeah, it was incredibly hard, but I did make some amazing friends there. So they kind of made the journey easy for me. But yeah, it wasn't easy at all.
So,
Wow.
in terms of moving around a lot in your younger years, like how do you think that's shaped you?
I think as an adult now, I don't want to move. I
Mm.
like my home. I like my safety. I like my environment, and I want to have that sense of laying roots. It's
Hmm.
how I say that, but I think it's shaped me in a way that it's given me that broader perspective. I'm more open to receiving from anyone and everyone. Uh,
Hmm.
and that's given me that sort of view from other person's perspective as well, because I've seen and met so many different kind of people, different cultures, different languages, different food. So I'm open to it. But I
Mm.
always crave that, oh, I wanna be now rooted as much as
But do you know
Stability.
what? I think that's so interesting that now you're open to it. I think even in dentistry, I was having a conversation with someone and I feel like no, it was actually when Tej and I we went to the US and we met some dentists there and then you just think sometimes when you say you're a dentist, that's it. You can just see
yeah.
teeth. Like you're a dentist, I'm a dentist, I'm a dentist. But
Mm.
it's that broader perspective that sometimes we lack. And that's really interesting because your experience probably has broadened your perspective and widened your even thinking in
Yeah.
a way. So even potentially what you're doing today, which is incredibly creative, it's a venture you've created on your own accord, that's incredibly cool.
Thank you.
So how did you find yourself pursuing dentistry?
So dentistry was not on the radar at all. Well, actually, let me rewind that a little bit. It was always to do something in medicine, but
Hmm.
Mm.
like like a normal Asian household, become a doctor, become a lawyer, become something like, or an engineer. Yeah. So I always said as a kid, I'm going to be a doctor. I'm going to be a doctor. I'm going to be. And by the time that stage came, that high school time, I said no, I don't want to be in medicine at all. And I told my dad I want to do hotel management. And my dad said, absolutely not, not happening.
So why hotel management?
I don't know. I don't know why I thought it would be really cool at the time.
Okay.
Um, I wanted to go to Switzerland, and I just
Right.
idea really fancy
Uh,
of going to Switzerland, learning hotel. I don't know from where it came.
It
I
could be your ticket to kind of, explore, maybe
Travel, yeah.
even more.
explore the world,
Dad said absolutely not.
shut it down.
Exactly, he nipped it in the bud, and yeah, it came through them. I have to give them credit for it. They put in the seeds, and they reminded me how much I did want to be a doctor. And I said yes. So I went and explored some universities, went to some open days
Is this
um,
in Dubai?
in Dubai, and then went back to India as well.
Right.
Right.
Yeah, and then I looked at both places, and then yeah, we ended up back in India to do my dentistry.
And where in India did you do your dentistry?
I went to study in Pune.
Oh, wow.
Yes.
That's south, right?
No, it's actually west.
Maharashtra.
Bombay. Yeah, Maharashtra.
Ah, okay, fine.
Yeah.
Wow,
And
beautiful.
Pune is like known for its education, its universities.
It's quite a student hub, I feel like. It's from just from Nehal's mentioning we were in America, and there's a lot of people from all over the place there, and a lot of people who had a time of their life in India. They
Yes,
had Pune in like common, and
yes,
they were
it's
talking
known for
about
it.
certain places all the students kind of used to visit, and the like food places and da da da. And I was just sort of absorbing that conversation. But how was that experience? So
It was, well, again, if I think back to my like first week at university, I'm feeling really brave, and then suddenly you're in a hostel where the food is not your mom's cooking, and you're just like, oh my God. It
And
was
you can't self cater, right? Like you don't have cooking facilities, from what I understand. It's all in
no,
the
very different.
Wow.
canteen.
And does everyone live on campus every year?
Um, yes, yes, but you can choose to move out if your parents allowed you uh,
Hmm.
to move.
And do
And
you have like a female dorm and a male dorm?
yes,
Yeah,
oh,
yeah, yeah.
not just dorm, they're like a mile away from
Oh,
each.
like separate buildings.
Yes, 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 like
Yeah.
separate buildings and separate sites. They're like very far away from each other. There is a cutoff time by which you have to be back in at your accommodation. The
It
boys
might
come.
be a boarding school almost. Right.
Almost, yes. But yeah, there's a cutoff time. You have to take permission if you want to be out after that time. You have to have a permission slip from your guardians. Boys can't enter that area. You can't enter the boys' area. So it's very, yeah, that's just
So,
how,
so how did you have fun when you were at uni?
yeah. We
Breaking
found
rules?
ways.
Breaking rules?
Oh, of course.
Rules are there to be broken.
Exactly. And my parents then found out all about me breaking rules as well. But
So
I
your
didn't,
parents were in Dubai then, whilst you were studying in India?
yes,
Wow. And how often would you go back to Dubai?
every 6 months.
Okay, fine.
Yeah, not like every weekend when you're in London.
Yeah. Yeah, I know,
You have
literally.
a London
It's
home and,
just
and London
changed.
leave.
And you couldn't call as much because at that time there was no like,
WhatsApp. Yeah.
WhatsApp or like even BBM. You remember that era of BBM?
Yeah.
Yes, BBMs, yes.
There was no BBM. There was nothing. That came when I was like, what, in my final year? There was
Wow.
nothing. I remember like I had to pay 20 rupees per minute. So my dad would call me every Friday to even receive a call that, I would get charged.
Mm.
So my dad,
Right.
and we would make sure that we cut out right at the end of that minute.
Yeah. Watch the seconds.
Watch the seconds. So it was, yeah, you only spoke limited amount. If you needed money, if your well-being, everything was okay. Yeah, okay, everything's fine.
So was it a 5-year course?
It was a 5-year course.
And what stage do you start seeing patients?
Exactly same as here in third year.
And then do you have to bring in your own patients, or does the
No,
university?
our university was pretty good like that.
Right.
We had loads of patients come in.
And how many people in your year?
100.
Okay.
Yeah.
Similar-ish to here.
And then was it just were there other courses as well? Like would you in your building?
Yes.
Would there
So
be
not in the building, but my campus was
Yeah.
under a university where all the courses were. So there was medicine. So medicine was in the building right next to us.
Yeah.
There was physiotherapy, there was Ayurveda, there was homeopathy, there was engineering.
Wow.
All of us were all on the same campus, but different buildings.
Amazing.
Yeah.
And
So,
did you find university stressful?
yeah, yes and no. I think that obviously the exam periods and stuff that was stressful. But living away from home, or anything, I didn't find that stressful at all. I was just like, yeah, this is just something.
You're probably used to it by that point.
Yeah,
like
you
giving
probably
something
built
up.
up thick skin, right? Resilience.
Yeah,
Have that
definitely.
resilience because you moved around so much.
Yeah, I was just like, yeah,
You
okay.
probably didn't realize it, but you're probably forced to be much more independent, I think, from much earlier when you're sort of fending for yourself, right? You don't have your family, network around you close by.
I mean, I left home when I was 17, so I haven't lived with my parents since since I've been 17. So yeah, I'm pretty used to being by my own and doing things on my own. I'm hyper independent, good and not good, but yeah, I'm pretty used to just doing things.
So was the plan for you to study dentistry in India and then move back to UAE, like Dubai, or was it very open at the time?
At that time, it was very open because obviously nobody in my family was a dentist or had any idea of how life as a dentist worked. So it was pretty much left on me to decide what I really wanted to do. And I knew that I wanted to pursue some kind of postgrad education, as we all do when we're doing our undergrad. We're all motivated at the time.
I feel like it's more a sort of commonplace in India that you don't just stop at BDS. Like it's almost like everybody is doing some kind of further.
Yeah. Even if it's
masters or
public
something.
health,
Yes.
it'll be like either public health or any discipline. Like I feel like it has a specialty.
When did you qualify?
2010.
Okay, and then so it was the norm then to go straight into like specialty, pick up a specialty and train in it, or would you work for a bit and then kind of
would work for a bit and then go for the specialty? So you try to figure it out. That's what I did.
And what drew you to pros?
Well, it was actually my very motivated professors who said, you're really good at this. And actually, funnily enough, dentures came really easy to me. Something that all my friends hated. My classmates were like, how can you like doing this denture work? And we had to do all of our lab work. as well. So every patient we saw, we had to go and make the dentures in the labs ourselves. There was no like
Wow.
give it away for pouring the cast or nothing. Everything had to be done by yourself. So yeah, we got our hands dirty. So when I went in practice, I actually did realize that what they were saying was right, and I was naturally good at it. And I really enjoyed talking to the older patients as well. I loved hearing their stories of what has happened, and so yeah, that's what drew me to pros, and that's how I landed into being pros. I think if it wasn't pros, it would have been endo. That's my second love.
Okay. Okay, so then where did you like how do you decide going about it? Were you like looking at institutions within India at this point and abroad, or what?
I was looking at both, and I then started applying. And it just happened that I got accepted into QMUL. So I did apply to a lot of other universities as well. And QMUL was, yeah, it just landed. I think it was sort of meant to be. And
But you
yeah,
weren't like set like I want to do my master's in the UK or like Europe or America.
I knew that I didn't want to go to America because
Okay.
you have to do your DDS again. And I never wanted to settle in the US. In fact, I never even wanted to settle in the UK. It just happened. So the plan was get the education, go back to Dubai. That's where my family was. Again, I was just in that, I want to lay roots. I want to be closer to home. I want to be with family. So that was always the plan. And then, life has its own plans.
It does, doesn't it? So then you came to the UK and you did pros.
Yes.
And how many years was that then?
I was 3 years, MCLIN Dent and MRD.
Wow.
And
then
that's
did you,
sorry,
full time.
full time. Yeah.
Yeah,
Yes,
yeah.
full-time.
And then did you work as a specialist for a while?
Yes, I did. Since what, 2015 I've been working, and I even lectured at QMUL for a few years. I was lecturing with Health Education England, teaching everybody tooth wear and occlusion, and again, another two subjects that people don't like, naturally to me.
What do you mean by it came naturally to me? Do you just felt like it made sense in your head?
Yeah, it just made sense. It just,
Right.
like, I think the terms really intimidate people, and they intimidate me. Like, it came really easy, and I was like, well, you can get it. Just give it time. You will understand it.
So did you fall in like were you in love with pros when you started doing your MCLIN Dent? Like, did you love it even more?
I loved it even more, definitely. And I loved dentures even more. And more than that, I loved doing obturators. I loved helping cancer patients.
Yes.
That was something.
It's transformational. I remember when I did a SHO job in Max Fax, and I saw some of these appliances, and it's incredible.
Yeah.
And it must be so rewarding.
Yeah.
And that skill set is very unique.
So what's an obturator for anybody who doesn't know that's listening?
Yeah, so if a part of your maxilla or mandible is missing, then you would construct a prosthesis to sort of like block that area off, sort of like a denture, but with an added area to sort of replace the missing part, the missing bone.
So you can eat safely.
Yes, you can eat, you can breathe, you can drink. All of the basic functions. But yeah, as Nehal said, it is life-changing. And I really, really, really enjoyed doing dentures.
And at that time, did you think, right, I'm going to be doing this for another, happily doing this for another 10, 15, 20, 30 years?
Yeah, till the end of my, my time.
So what changed?
My own burnout, my own panic attack, which I didn't understand at the time.
Would you mind sharing how it presented for you?
Yeah, how it presented was a really unkind patient walked out of the room. And when they walked out, I just bursted into tears, could not breathe, sat down on the floor of my surgery. And my nurse had left the room as well to sort of attend to the decon. And I sat at the floor of my surgery, cried. And then I had to gather myself back, see the next patient. When they left, then it was lunch break, and then same thing happened again. And then I had to really understand what happened. So I went to the GP next day and I said, look, this is what happened. And bless my GP, she was lovely. she told me, stop working so hard, cut down your days. You would describe this as anxiety. And I was like, no way. How can I get anxiety? It was seen like such a taboo in my own mind. Like, that's for weak people. I didn't understand that I had to make sure that I'm okay as well. That was not something that you're taught ever. You're just left on your own devices. And I think I had gone through so much in my life. I'd moved so much, seen and done so much. And then I was like, why is this happening now? It's when you've ticked all the boxes, you've done everything, your nervous system has sort of gone in that overdrive. You just have sort of collapse unless and until you actually make a plan to take care of it.
So are you saying that it was always kind of there, but it was suppressed?
Yeah, I think so. I think it was always kind of there. I was very much a perfectionist. I think that's why I ended up in pros as well. Like 5 millimeter makes a difference to us. Yeah, very much a perfectionist, very much a warrior, very much had to achieve. Had to do the best possible way. Yeah.
And when was this kind of like burnout got at his worst? When did it happen?
2018.
So pre-COVID.
Yeah, pre-COVID.
And so you'd been working probably what, 3 years?
Yeah, pre-COVID.
As a specialist?
Yeah.
So it's quite a long time.
Yeah.
Quite a long time.
So it just hit you then, you did something about it, you went to the doctors, and then did you take on board the doctor's advice? Did you cut down your working days?
I didn't.
Right.
I was working 6 days a week at the time. I continued working 6 days. I'm like, no, this can't happen to me. But yeah, the feelings of, then I started to read a bit about anxiety and burnout. And I said, yeah, I have got all of these symptoms. The GP obviously advised take antidepressants straight away, referred me for therapy. I did not take the antidepressants, but I did go into therapy. And I was like, no, this can't be it. Like my life, this is not it. I need more answers. I want to understand this more. My mom's very spiritual. So that's when I said, right, I'm going to give other tools a try. And I did. And I started to find my way back into happiness, way back into joy, way back into loving my life again, way back into loving dentistry again. I started my own healing journey.
If you're enjoying today's episode and you are a female dental professional, we'd love to invite you to our monthly face-to-face coffee morning.
It's a safe, supportive, intimate space to connect, share, and grow together.
You can express your interest by filling in your details through the link on Dr. Tejal's link tree. You'll find it in the show notes.
Now, back to the episode.
So tell us, how long did that journey sort of, when you're navigating all of that, it's obviously a process. It's not something that, just happens over a weekend or a week or a month or something. How long did it take you to get to a point where you're like, you know what, I'm happy with where I'm at?
Yeah. I think, so anybody who comes to you and work with me, I say, healed is not a destination. You're never going to potentially heal, but you are going to get to a place where you will navigate the issues that you couldn't navigate before very, easily or differently than you did. So your life will start to look different. You will start to experience it differently. And I think that changed for me after about a year. After I had been to talking therapy myself, I had done a lot of other spiritual work, connected back, sort of making time for my own self as well, giving myself that space.
So did you eventually cut back then? The clinical?
Yes.
How long since when your GP said to cut back to when you actually cut back?
A year. Well, even then I went back to 1 year.
I find this interesting because I know that even I've been, sometimes, well, even if we use the typical example of your parents telling you something to do something rather, and you don't do it until you want to do it or you're ready to do it. So I get that. And you have to work it out for yourself.
Yeah.
And figure out when is right for you.
So did you find cutting back helped?
I think for me, shifting. So I found my joy in teaching. So I think shifting to a teaching role really helped me. It gave me that outlet of, something that wasn't coming. Like I wanted to share what I had inside. So moving my time less into doing clinical, whereas more into teaching really helped me. So I wouldn't say I cut back, but I think I changed the way
Yeah.
it worked.
Yeah. Yeah.
And
You have to
during the
change things if you want different results, right? So
Yes, yes,
exactly. So you changed it and you shifted it.
yeah,
Well done. And well done for identifying, that teaching is something that is, one of your values and something that you really resonate with and that you connected with and you really want to
yeah,
incorporate that and actually doing that, because I think there's a lot of people who have similar things. They love, sharing their knowledge, or they love teaching. And there's some people who are just really good at being able to stand in someone else's shoes and, and explain things in a way that people just get it. And I feel like it's almost like a gift, and you've got to share it and do it. But I know it can be quite difficult because teaching doesn't pay as much as clinical dentistry, right? So you're taking a pay cut whilst you're
huge pay cut, huge.
Right.
Yeah. And you have to factor that in. So at this point in your life, were you with a partner or were you
I've been married since 2012, so yeah.
2012? Fine. So during your specialist training?
Yes, yes.
Yes.
So, like I said, I wasn't intending to stay back, but I met my husband, and yeah, we decided to just get married. And he's also a dentist, and yeah, he was busy in his clinical practice. I was busy doing my training, working, and yeah, I was with him, and he's really supported all of this journey so far. So yeah, he's been lovely.
Oh, that's lovely.
And at what point did you decide, all this time, were you carrying on with therapy as well?
On and off, yes. I feel that everyone should go into therapy. Like
Why do you feel that?
I feel that's such a non-judgmental space. You can talk about anything and everything and have no fear of judgment at all. Because yeah, the therapist is there to support you, not to judge you. They want you to heal, progress, move forward, and not there, make you feel like you're not good enough, or you're not doing enough. All of those fears and resistances that you could possibly have, that guilt and shame, you can just strip it off, and you
And
can.
what would you say to someone who would say, Aditi, I don't have any issues. I feel fine. Do I actually need therapy? What would you advise them?
Yeah, it's actually very, very common and very normal, because we're not taught to take preventative action. We only go and seek help when things go wrong. And even then, when it comes to mental health, especially in Asian community, saying openly that you've been in therapy, it's a huge taboo. Like, there's something definitely wrong with you. But having that space is such a blessing. It's really like I really feel like you can't describe it in words. It's just such a nice space to have.
Did you find people, like your husband was really supportive? I presume that he was aware that you were doing this. And then what about your parents? Did you share it with them?
Initially, I did not,
Hmm.
because I think they would not understand, and they, more than understanding, they would worry. It's gone wrong, and we need to help her. You know how parents worry. It's normal.
Yeah.
Yeah.
Like she's gonna get addicted, she's gonna need it forever.
Yeah, all of those worries. But eventually, I told them, and they're fine. Like, they're like, okay.
How did you have that conversation?
It's funny, I did it. My husband did. Yeah, I know. One time.
That is excellent delegating.
I know. Well, I didn't even have to say it. I was one time on a therapy session, and my husband was having a family WhatsApp call. And my mom asked, "Oh, where is she?" And he's like, "Yeah, she's with her therapist." And she's like, "Oh, okay, cool." And that's it then. He broke the news for me. So, but after that, yeah, my mom was like, "Okay, but why can't you talk to us?" And I said, "I can." It's a non-judgmental space, and it's my space to vent and talk and understand myself, not to throw blame around. It's for me to understand who am I, how do I function, and if I've been functioning this way and it hasn't been working, how can I change this? That's what that space is for. And she understood that. Yeah. And
wow, that's really insightful.
I find it. Sorry, Nehal, go on.
We're both clearly so excited to speak to you. We're just so excited. But I think thank you for being so open about that, because I think a lot of people may not be, as open to sharing about this, but also a lot of people might be completely unaware of the possible benefits of therapy. So thank you for being really open about it. And I think there is still some taboo, especially if, we're dentists, we're professionals, like we don't need therapy, when actually our group of people probably are the ones that could benefit greatly from it.
And
Just because of the emotional load we go through every day.
Yeah, and I feel like it's just a healthy thing just to have that space or protected time in the week to be able to just share openly, like you said, non-judgmentally, and somebody's there to kind of guide and support and to help. And I feel like also this is exactly the point you mentioned, and I think I'm going to stress it again that it's not something that you have to wait until something goes really wrong, so like really crap has hit the fan and you're just really in a bad patch and you're like, I'm so desperate, let me just try this thing, which is still fine, like it's better late than never, but also just to be like actually something, you're struggling with certain things or you're not feeling great a certain time, or whatever it is, it might not be affecting your life massively, but it's a tool that you can access even if you don't have a diagnosis, let's put it that way, or you don't have you've not had panic attacks or not had like hit rock bottom or burnout. It's something to actually elevate your well-being, right?
Absolutely. And we all have issues, right? We might be constantly either worrying about something or, as I said, I was a perfectionist and I had to get everything right. And it would make me very upset. I would
How
get.
did you let go of that, Aditi?
It's a work in progress. I have to be very honest. But
Yes.
now what has changed is that I recognize it very quickly and very easily. Immediately there will be, because I've done the work for so many years, immediately I'll know, oh, okay, I'm trying to make this perfect. It doesn't need to be perfect.
So then what do you do?
I
Do you
react.
just stop yourself?
No, I react differently. Well, once you have that recognition, you can respond differently. But if you don't even understand how you're functioning, how are you going to respond differently? How can you be different if you don't understand you? So I really understood what it's, what's causing this perfectionism. And then I understand it. Okay, I'm trying to be a bit controlling. I'm trying to be perfect here. Let's step back. Let's see, how can I change? Yeah, how can I change? How can I react differently? What do I actually need from this situation? Have that internal dialogue with myself. That's what I do now.
So did you find that your personality type was not suited to clinical dentistry, or is that quite a bold statement?
Yeah, maybe it is. I think the dentistry wasn't an issue. It's all
Right.
the other things, the paperwork, the referrals, the fear
Yeah,
of patient.
it's yeah. I always say this actually. Imagine an island where you could treat people,
Yeah.
and it would be just trust. Like back in the
Yes.
day.
Yeah.
I think even if you look at the notes of patients that were done like 15 years ago, they're completely different to the notes that we write now.
Yeah.
And so yeah, I totally get what you mean there. There's been a massive shift and a change in the profession,
Yeah.
and I think it's right. I think it's
The
the other
environment.
things that stress people out, like the admin, the notes, the referrals, dealing with difficult patient scenarios or difficult situations. It's tough. It
Yeah,
really is.
even working within teams, like the nurse dynamics, the dynamics with the lab, the dynamic with your principals, all of that, it affects you as a clinician. So doing dentistry, I could go back to doing dentistry right now, but
Yeah.
that comes easy to me. It's all of the other stuff that I found difficult, and I understood why I found it difficult. Because I understood myself. I didn't understand it before. So yeah, maybe when I go back, it'll be a different thing. But definitely, it's something to think
So
about.
when you made your shift, you said you shifted your working patterns. So you were doing less clinical but more teaching, but you were still working.
Yeah.
And then you cut down. So
Yeah.
talk to us about that journey of how did you cut down and what were your next steps?
Okay. So during the time of my going through this anxiety, all of these panic attacks, I also suffered from decurrent stenosynovitis, which is a very painful condition in your wrist, where your tendons get inflamed because of repetitive movements.
What is that condition called again?
It's called decurrent stenosynovitis.
No one talks about wrists. Everyone talks about your back and your neck. No one mentions wrist. And what were your initial symptoms for your
Initial
wrist?
symptoms, so I was getting a bit of pain. I was getting cramps. I would just ignore them. I would just, do a bit of stretches and just be like, yeah, take a little break, drink some water, you'll be fine.
Pins and needles?
A little bit, yes. Ignored them all.
Mm.
Pushed
What is
until
it called again? Could you repeat it?
yeah, it's called decurrent stenosynovitis.
Wow, this is going to be our word of the day.
Yeah, it's mouthful.
Yeah. Okay. So then that happened. And
How
how
did you
many
get that
years were you
diagnosed?
working
Sorry, can we just
clinically?
rewind? How did you get that diagnosed? Like,
I have a consultant colleague. So basically, I woke up one morning, a numbness in my thumb, couldn't feel it at all, my right hand. Panicked because, well, my career, my life. And I called him and I just said, Dr. Costas, this has happened. And, what do I do? I'm panicking. And he's like, oh, okay, don't worry. Just come and see me. So I did. And kind of helped me. He's an orthopedic guy. So I went to the top guy, went to him, and it was him who gave me the diagnosis and said, right, there's, you can rest, you can get steroid injections, or you could get surgery. So I said, right, where do we start? He said, rest, you have to rest it. So I did. I took 2 weeks off, rested it, didn't make any difference. The sensations came back in my hand, but the pain was still there. And then he suggested steroid injections, which I did have in both of my wrists. And after that, those painful steroid injections, I had to take some time out again a few weeks to recover. And yeah, things started to get better. I had 2 rounds of steroid injections. They were starting to get better. My left hand was not 100%, but it was manageable. I was able to work. I was cleared by OK Health. So all of that was going okay. Then COVID came about, and then I got the rest from clinical dentistry that I needed. It was when I went back from my maternity that the pain came back. So the third time, so I've already had 2 rounds. Now the third time, if it comes back, you have to have surgery. Either you pause or you have surgery. And I didn't want to have surgery on my wrists because the prognosis wasn't amazing either. So you're kind of like, yeah, we could do the surgery, but we can't guarantee this will ever go away. So that's when I took the bold decision of pausing things and seeing how it all flows.
Wow, well done.
Thank you.
Well done for taking that decision, because I can't imagine how difficult of a decision that is when you have life happening, when you have bills to pay, when you have things going on.
but once
It's
you've also
really
invested so
difficult.
much of your life,
Yeah, and your
Right?
talent, your raw clinical talent,
Yeah, and not to forget the student debt.
Yeah, and also it's in a weird in a weird way, it is kind of your identity, right? Being a prosthodontist.
Yeah, I mean, definitely. I really struggled a lot thinking, oh my God. But mainly I also struggled thinking everyone's going to think I've failed. And I kind of recognize that, that it was all of the tools that I gained over the years from then on really helped me through that phase of my life where I said, I have to make this hard choice, where I pause. And yeah, that thing of like, oh my God, I failed. Like my body has failed. And I did have a very difficult pregnancy as well. So kind of that also sort of went along that, oh, like what is going on?
how do you reestablish faith or what has helped you reestablish faith, trusting your own self and your body again? Like when you feel like your body's letting you down.
For me, the miracle of becoming a mom, I made a body inside my body. Like, come on, like I have to stop doubting myself. I've healed through so many things. I've moved. My body has support. I had to remind myself what all my body has supported me through, and it's still doing so. So it's kind of like establishing that, okay, you're not my enemy. You're my home. And I have to love you no matter what. So if this is what's been thrown at me, what can I do to help and support my body? So that's kind of what I did.
Amazing.
I love that. What can I do to help and support my body? Yeah, it is our home. That's beautiful.
Where are your energies going right now?
So my energies are going into three things. Compassion Focused Dentistry, the program.
Okay, let's pause that. What is compassion focused dentistry?
So it's a structured program. It takes its roots from compassion focused therapy and compassion focused staff support, which are like, to explain, it's CBT. Everyone's heard of CBT.
Yeah.
So it's a branch that called compassion focused therapy, which is all about developing compassion within you, which flows in all three ways. And what I mean by that is that it flows not only outwards, which we are very good at doing, but also towards you, which we really need to keep going, to keep functioning. So the program involves a lot of psychoeducation to understand your brain's evolution, understand your nervous system, understand how we take what all we have been just given and we don't have control over, but we can respond differently. It addresses shame, criticism, again, all of these things we kind of suffer with, perfectionism. And it also offers tools like breath work, imagery, and creating this compassionate kit bag, which, and I say kit bag because, it's not something you use in case of an emergency. It's something that's an ally. It's something that you can use on a daily basis, as and when you need to sort of keep building on. So that's what this program is about.
Is this something that you are like you're working with people specifically within the profession? Like, so how does it work? Like, is it like a one-to-one thing? Is it a group thing? Is it an online thing?
Yeah, so far it's been a one-to-one thing.
Right.
But I'm developing this now into a group thing. So starting from November, I'm going to start a small group, which will involve 7 people. So if any of the listeners would like to join along, drop me a line. That program is going to run absolutely free. That is my offering, sort of giving back to the profession. So I want to invite 7 people in and see how they feel as a group together, because group work is very different. Very
one-to-one. Yes.
One-to-one. So yes, I'm developing it into group work.
And is this open to, when you say sorry, Tejal, when you say people in the dental profession, is that dentists, dental nurses, hygienists, therapists, practice managers?
Everyone.
Great.
Yeah.
Great.
Because
it's online, and it's online, not in person.
No, not in person. I feel like with the way the world has moved, online makes everything so accessible. I want to make it accessible to as many people. Like someone sitting in Scotland, I'm here in London, right? So someone sitting in Scotland should have access to me. So yeah, I really love doing online work.
Excellent. We use the technology we have in a very positive way. Amazing. So 3 ways your energies are going. One of them is compassion focused dentistry, which you've just spoken about. What are the other 2?
So second is the Dental Wellbeing Hub, which is sort of a place I've created to get a sense of community, that we're all humans first, dentists second. We all have same, or dental profession second. We all have similar struggles. So coming together and sharing those struggles and gaining tools. My focus is really on prevention. If I had the tools I have now, I don't think I would have burned out. And I really want to put that out, especially for the younger colleagues. They're coming out of university or in their early days. They're so passionate and so ambitious. I want that ambition to last. I want that to lead somewhere which is not burnout.
Yeah.
So yeah, that those simple, small preventative tools that, again, they can use every day, as and when, between clinics, between patients, at their lunch break, after, before, and, just create that space through, again, workshops. And third is, of course, one-to-one work. That is for when crisis point hits and they really need some additional support. So these are the 3 avenues, and I won't forget, I'm a mom as well, so that's my biggest source of where my energy is also going.
Of course.
Wow. I mean, how you handle everything whilst being a mum as well is incredible. And I think I think our listeners will definitely find value in all of these things. And it's exciting, Aditi.
It's really exciting what you're building.
Really exciting. There's a space for it. People can genuinely benefit from it. And it's I think it's going to impact. It's going to have great impact and also ripples you know, because those people that you impact, they will change and it will influence their surroundings. And I think it's an incredibly powerful initiative that you're creating. Well done.
Thank you. Yeah, I'm really excited about it because I sat on it for a few years. I wanted to sort of blend in the two worlds. This was pre-COVID, when I went through my journey and I saw what a great impact it has had on me. I always kept telling my husband that, oh, I wish I could bring this into dentistry somehow, but I didn't know how at the time. But I always had that
So how did it come to you?
Well, when I decided to pause, I had during these years already studied to be a psychotherapist, a yoga teacher, qigong teacher, hypnotherapist.
So why did you have to become a teacher in all of these things? Is this because you love teaching and you want to be able to share what you've learned with other people? Is that your driver? Or is that more for you to then explore
for me
in a deeper way?
Yeah, because I thought, oh well, the teacher knows quite a lot, so I need to know everything about this because this has helped me so much. I want to know how this can help me even more. It was more of a selfish reason why I wanted to learn. I want to understand how the brain is ticking. I want to understand how the energies are working. Why is this thing helping? Why is that not helping? So all of those things. So yeah, I think just going on courses shifted from going for clinical courses to going on all of these other courses. And I would do weekends. I would even go volunteer with my teachers and just go help them out in running workshops and stuff.
Wow. Do you feel like your nervous system has changed? Like you're more parasympathetic nervous system?
I mean, anxiety, stress, it's there to keep us safe. It's not going to be not working towards getting rid of them. We're working towards managing them in a different way. So definitely I've shifted a lot. I react very differently. And it's not just me, I say that, and I've voiced about, but it's also like my husband noticed it. My mom has noticed it, So as you talked about ripples, it does ripple out. Your family, your friends, they start to see you differently. They start to talk about you differently. They start to talk to you differently.
Yeah.
Yeah. I suppose the people you attract as well is different.
Yeah. Definitely.
Yeah.
What a journey, Aditi. Thank you so much for sharing so openly, and we love that. And I think it's like Nehal said, takes a lot of courage to pivot to your career as well, and sort of let go of those identities, the expectation of having a certain income, and just to start from basically the ground up, and there is a lot of excitement in that, and we're really looking forward to seeing all the wonderful things that you will be you'll be doing and getting up to, and if you haven't already joined the Dental Wellbeing Hub, there is it's a wonderful space. Aditi is so very kindly just holding space for people to help them in their journey, and so check it out for sure. And as we wind up this episode, this conversation, Nell and I usually request our guests to share one bit of pertinent, like one bit of advice. Like if there was one message you wanted to conclude today with, what would that be?
The care and compassion that you flow out to your patients, that you give out to everybody around you, offer just 1% of that to yourself every day. Just 1%. Start with the 1%, and the rest will all unfold. So bring that into you.
Wow, I'm really going to try and take that on board.
Love yourself, be kind to yourself, listen to yourself.
Show yourself compassion. Thank you so much, Aditi.
Thank you guys for having me. It's been an amazingly inspiring talk, and it's been amazing to be in the space. Thank you.
Thanks for tuning in. If you enjoy this episode, don't forget to hit follow on Spotify or Apple Podcasts, and hit subscribe on YouTube so that you never miss a new one. It really helps if you rate and review the show, and if you found this episode valuable, share it with a friend, family member, or colleague. We appreciate your support, and we'll catch you next time. Bye-bye.